Welcome to our lecture today. We are going to talk about nursing. We're going to talk about the different educational pathways in nursing. We're going to discuss different specialties in nursing and a whole other host of fun topics surrounding the profession of nursing. So let's get started. We know that nurses are a vital link to improve the health of individuals and society. Nurses are kind of one of the more trusted professions in the United States. We aim to protect, promote, and optimize the health of our patients. We want to prevent illness and injury and really alleviate suffering. That is part of what we as nurses all kind of collectively have as a very core of how we like to practice our craft. And so there in education and practice are different things to consider. There are different levels of education in nursing. There are even different types of licensure. We can start as maybe a transporter, maybe in a hospital setting. Maybe we worked as a certified nursing assistant, worked our way up then and went to LPN school, became a licensed practical nurse, and then went on to become a registered nurse. And there are opportunities even beyond that. And so there are lots of different levels in nursing. Here we can see a couple of different types of professional settings. We can see a flight nurse up there who works by taking patients from a trauma situation out in the field, getting them on a helicopter, air ambulance, and flying them to a hospital where they can receive care. We can see a young nurse helping an elderly woman take her medications. We can see a gentleman holding a baby. Nurses take care of new moms and new babies, and believe it or not, there are not only more and more men in nursing, but actual men working in obstetrics. Here in Maui, we have had for the first time 2 of our graduates, male students, go work in our obstetrics department at the hospital. And they've done very well. We also can see the nurse here working as part of a team. So that's something that we do as nurses also. And so for educational career paths in nursing, we've got actually 2 pathways that lead to the registered nurse or the RN, and that is an associate degree in nursing. That would be the type of degree you would get from a 2-year associate's degree. Although there is also a BSN or a Bachelor of Science degree in nursing, which you would get from a 4-year degree. Both of them are degrees that lead to qualification to sit for the licensure exam for a registered nurse. Here we can kind of see a pathway starting with LPN, practical nursing. There is also diploma nursing. Not as many diploma nursing opportunities today as there were many years ago. These were the types of programs that were maybe in the hospital, where you learn nursing in the hospital. And then we just looked at the RN leading to the ADN, the RN and the BSN. And then, of course, beyond that, right? So there's Masters of Science in Nursing, in which case then you are qualified to sit for the licensure exam to become an advanced practice registered nurse. There is also a Doctor of Nursing Practice now, which again prepares you for work as an advanced practice registered nurse. And then still the traditional PhD in nursing or Doctor of Philosophy in nursing as well. And so the APRN, or Advanced Practice Registered Nurse, works in specialty. So these are the nurses that we see working in primary care, like at the doctor's offices. Some of them specialize in geriatric care, caring for elderly patients, pediatrics, caring for children, neonatal nurse practitioners working with newborn babies, and family nurse practitioners, which they just work with families. So they'll see children, they'll see adults in a primary care type of a setting. So nurses provide, nursing, the profession of nursing provides an opportunity for you to commit to lifelong learning and career development. And so a nurse midwife is an advanced practice registered nurse that takes specialty training and a specialty exam to become a certified nurse midwife, and then can deliver babies and provide health care to women. A nurse anesthetist, or a certified registered nurse anesthetist, is also a type of advanced practice registered nurse, and they work in settings where they are putting patients under anesthesia during procedures, during surgeries. And so this is another type of career path. You could take a career path like I have, which is to become a nurse educator. A nursing instructor usually has a Master of Science in Nursing, a Doctor of Nursing Practice, or a Doctorate of Philosophy in Nursing. And what we do is we dedicate our lives to mentoring and training new nurses. Nurse administrator is someone who works as a nurse leader in some type of institution. For example, a chief nursing officer at a hospital, or a director of nursing at a nursing home might have be an RN, and also have a master's in business administration, or perhaps a master's degree in public health. And again, there are different opportunities for being a nurse administrator. Being a community health nurse is a nurse usually with at least a Bachelor of Science in nursing. Nurses that work in public health usually are BSN or higher. You may also work in this environment with a master's in health administration along with your RN, or even a master's in public health. So being an RN and having a master's in public health. And so these are just some of the different master's degrees that are offered. And it's just important to know what is out there so that as you grow in your professional role, you become more interested in certain areas and know that you can pursue those areas. So let's talk a little bit about what are the responsibilities of a nurse. And although this is not an exhaustive list, there are certainly many more things that nurses do. I'm going to kind of focus in on the nurse as a caregiver, a leader, person who delegates in a team type of a situation, who understands the law and the legal implications of nursing, ethics, and lifelong learning. So in terms of care, nurses provide bedside care to patients. We are generally very compassionate and understanding about the experience that our patient is having This is a good time for me to differentiate the difference between sympathy and empathy. Nurses really need to develop a sense of empathy for the patients that we care for. And what that means is that we're kind of able to put ourselves in their shoes, that even though maybe we haven't had the disease that they have had, that we can understand how that disease might be limiting their life or impacting their quality of life, and that we can be compassionate about what they're experiencing. As opposed to sympathy, which is just really feeling sorry for someone. There's a very big distinction between those two things. We don't feel sorry for our patients, but it is important to have compassion and empathy for them. Nurses are leaders. A lot of times on the healthcare team, the nurse will be one of the go-to individuals who has an overall picture of what's happening with the patient. Everyone usually wants to talk to their nurse. So a physical therapist might want to talk to the nurse about a patient's progress or about what's going on with the patient. The physician certainly will discuss the patient's care with the nurse and what things are working and what things may not be working. So it's really the whole, what we call interdisciplinary team. We can have physical therapists, we can have occupational therapists, pharmacists, doctors, the certified nursing assistant. We all work together as a team. And oftentimes the nurse will kind of, in a way, be leading that effort for our patients, especially in the hospital setting. And so nurses are leaders. Nurses are delegators, and so this is a big responsibility of a nurse, and that is delegating certain responsibilities about patient care to others. And oftentimes these are to unlicensed assistive personnel, or in some case it's people who may be licensed in a certain area. But delegation means that we are giving away part of our work to others, because it takes a team to get all the work done. The nurse cannot do all of it by his or herself. We need to be able to delegate appropriately to unlicensed assistive personnel. An example of this might be delegating the nurse aide to give a bath to a patient, to take the vital signs of a patient. And we're going to talk a lot about how to safely delegate. What are the rules for delegation? How do we know what's safe to delegate and what we should probably not delegate? And so we'll get more into that later, but delegation is a very important aspect of a nurse's responsibility. Nurses have a responsibility to provide safe care, and so there's actually a whole legal scope of nursing practice, and what that means is that as a licensed practical nurse, you have a scope of practice which is actually defined by the law, so that when you become licensed, there's a certain expectation of what your role is, what type of care you can provide as a licensed practical nurse. And so we will spend time in this curriculum learning more about the scope of practice in nursing and what it means to follow a standard of care and provide safe care to all the people that are entrusted to us. Nurses have a code of ethics, and many disciplines do have a code of ethics. I know that physicians have a code of ethics. I believe attorneys have a code of ethics. There are different professions that come with it, a set of behaviors that we expect. We will talk again in more detail about what each of these words mean, but nursing ethics involves integrity, veracity, which is telling the truth, fidelity, which is honoring our relationships with our patients, non-malfeasance, which means to do no harm, justice, which has to do with fairness and treating all individuals, all humans, with the same dignity and respect. Autonomy, in both that we as nurses practice sometimes in somewhat of an autonomous way, but also in that we try to promote autonomy for our patients as well, and a word called beneficence, which is really the idea that we always are striving towards doing the best possible thing that we can do to promote a good outcome for our patient. And so we'll talk more about these moving forward. You might want to start familiarizing yourself with what these words mean. They're in your textbook, they're well defined, so I encourage you to do that. Nurses are lifelong learners. There's a difference between what we looked at before in terms of educational ladders that we can go up to get more certifications, more degrees. Even in our own clinical setting where we're working, though, we are learning every day. We're learning every day about new ways of practicing in our environment. We're learning about new equipment that's coming on to our units and into our workplaces. And so we are always learning. We know that well-informed nurses are happier and more confident in their nursing role, which helps with job satisfaction. We also know that lifelong learning can help nurses advance in their careers and, of course, earn a higher salary, which is another good thing. So I should probably just mention that it is a requirement now in the state of Hawaii that nurses do continuing education. And so we need a certain number of continuing education units each year, or CEUs, in order to maintain our license. I want to take a little bit of time to talk about some of the healthcare services or the areas where we work as nurses. And so the types of services include preventative care, which is the type of care that we talked about a little earlier. We talked about blood pressure screening, diabetes screening, immunizations, mental health counseling. These are preventive types of care. There is also primary medical care. This is kind of the type of care that we get from our doctor's office, the maternal child health care that expecting moms get, that we get when we're experiencing an acute illness. For chronic disease management, once a disease has already happened in the individual. But another example of primary medical care would be nutrition counseling for a diabetic. So in other words, we are there to care for this individual and to provide counseling for them on what some of the best options are for good blood sugar control. There's also restorative healthcare services. An example of this might be cardiovascular and pulmonary rehabilitation, home care, spinal cord injury programs. So after there's been a spinal cord injury, you would have to go and get some rehabilitation to maximize your ability to function. Stroke rehab involves physical therapy, speech therapy, and also occupational therapy. So these are kind of restorative healthcare services. We have different levels of healthcare. You'll hear people talk about primary care, secondary care, and tertiary care in healthcare circles. And so it's important for us to kind of recognize that primary care involves our general physician providing care in the doctor's office, an advanced practice registered nurse working to provide care, a physician's assistant, a dentist, a pharmacist. These are all individuals, professionals who work in primary care. Secondary care is more focused on problems that require more specialized clinical expertise. Acute care in a hospital, surgery, treatment for cancer, and chronic disease management. And then there's tertiary care. And notice that as these levels of care increase, so do the dollar signs, meaning that in tertiary care, when we are managing rare and complex disease and disorders, we're talking about organ transplants, rare and difficult to treat disease states in a tertiary care setting. And so the higher level of care is definitely increasing the amount of cost that is incurred not only by the individual, but society as a whole ends up really taking on the burden of helping pay for these costs. And so where are some of these places, these different levels of care? Hospitals, long-term care or nursing homes, academic settings like colleges, universities, that's where nursing instructors work, nursing professors. We have nurses that work in schools. They serve our keiki as the school nurse. We have assisted living communities. We have nurses that go to people's homes and provide private home care. We have clinics like Kaiser Permanente. We have private doctor's offices. I got schools on there twice. We have nurses who work in correctional facilities or prisons that work in rehab facilities. We have nurses that work in research institutions and even insurance companies. And so here we see some nurses working in hospitals. We call this acute care, bedside nursing care in a hospital setting. And you can see a med-surg nurse up on the top. This nurse that's on the bottom image is an ICU nurse working in the intensive care unit, a little more specialized type of nursing care in a hospital. We have skilled nursing care, SNF, or SNFs are skilled nursing and rehab. Nurses will work in these facilities providing skilled nursing like tube feedings, dressing changes. You might have a patient with a wound vac. We see here a wound vac in the top picture. On the bottom picture, we see a nurse hanging an IV on a patient, and that's providing IV antibiotics. So this is skilled nursing care, which can happen kind of in a long-term care setting or even in a hospital. Private home care focuses on the client and family's independence, and we want to manage and coordinate their needs in order for them to stay at home where they are comfortable and in a familiar environment. There is memory care now, which is kind of aimed at those with Alzheimer's and dementia. There's special residential places where our patients with Alzheimer's and dementia can get the kind of care that they need, and that these folks are specially trained to deal with unique issues that arise as a result of their dementia and Alzheimer's. We have adult daycare centers. These are the type of facilities where families go out and work during the day, but that their elderly mother or father live with them at home. But during the day, they need to go be supervised. in a place where there are nurses working, and so mom and dad go off to work. They drop grandma or grandpa off at the adult daycare center, and we can see here that these facilities can assure that the clients are receiving their medications and any other type of health care that they may require. We see some ladies here in an exercise class, kind of getting their exercise in for the day. And so these are really nice environments for our older adults. There are also assisted living and independent living places which offer a long-term care setting with kind of a home environment and greater resident autonomy, meaning that there's somebody that comes in that can help provide laundry, assistance with meals, personal care, kind of like light housekeeping and 24-hour oversight, but that you kind of have your own unit or your own apartment with some common areas where you can go out and socialize with others. So these are also very popular. I mentioned before that some nurses go to work dressed like this every day, meaning that these individuals work for insurance companies and pharmaceutical companies. So there are nurses that use their nursing knowledge to work in other kind of types of industry as well. And so we've already mentioned healthcare services like continuing care, which would be assisted living. So what are some of the specialties in nursing? We've mentioned them, some of them already. Nurses can work as a surgical nurse. You can be a nurse that works alongside of the surgeon in a surgery suite. There are scrub nurses and circulating nurses in those settings. There are nurses who work in hospice. These are nurses who care for individuals at the end of their life. People who are no longer seeking treatment to cure whatever it is that they have wrong with them. They are going to allow nature to take its course, and they have accepted that. They will often be assigned to a hospice nurse who will help you pass on to the next experience of this life with dignity, and doing it in a way that you want to live out your days, at least on this earth. And so oncology is another specialty. These are nurses that provide chemotherapy for patients who are diagnosed with cancer. This is a very highly specialized type of nursing. There are nurses who work in diagnostic centers, helping physicians do diagnostic tests like stress tests and other diagnostic tests to diagnose patients. Some nurses work in cardiology. They specialize in caring for individuals who have problems with their heart. We know that intensive care is a specialty. Emergency department is a place where nurses work as well. And of course, education we have mentioned before. So some educational career paths. I think we've kind of already gone over these, so I'm not going to spend a whole lot of time going over these again. There's APRN, our certified nurse midwife, and our nurse anesthetist, our nurse educator, our administrator, our community nurse. And then there's also a type of option for a nurse case manager, which I don't think we've talked about yet. This kind of nurse advocates for options and services to meet an individual's health needs. This kind of nurse kind of oversees the management of patients with really specific complex health problems. They're usually held accountable for some standard of cost management and quality. And then, of course, a nurse can work as a nurse researcher. Here we see a nurse with a PhD, maybe works in an academic setting, hospital, or independent professional agency. And so an example of a nurse researcher could be something like this. You might be working on a floor and you might notice that the rate of falls has increased on your unit. A nurse might ask a research question like, what can we do to decrease the amount of our patients who are experiencing falls on our unit? So as a nurse researcher, you ask the question, you go into the literature, and you find out what they've done in other hospitals and on other units to decrease their fall rates. And so you put together a program that you're going to implement on your unit to hopefully help decrease the falls on your unit. And this can be things like putting a fall risk sign on the door, putting a bracelet on patients who are at a higher risk for falls, just using a fall risk assessment tool to identify those who are at a higher risk for falls. And all these things can be put together, implemented on your unit, and then you can try 6 months or a year to then go back and look and see whether it actually impacted fall rates. Did less people fall as a result of these interventions that you've done on your unit? And so that's an example of how you or I could be a nurse researcher right in our very own facility. So that is all I have for you today. Thank you for your attention, and until next time, aloha.